Hello, this is Group 46 and welcome to the Winklespruit clinic situated in southern KZN. So basically our patient gets access to the clinic through the gate, the main gate, where they are assisted by a security officer. They are then wheeled into the wheelchair ramp. We can see that although there are little bumps on the road, but there is a wheelchair ramp where the patient can access the clinic adequately. The door also has adequate space for the patient to move. The patient is then taken to the reception area where they are asked what they're here to do. They're then taken to the vitals room. The vitals room is a very important hub within this clinic. The patient is checked for their blood pressure, they check temperature, glucose, and they also receive a card whereby their vital signs are written. This is very important, as we can see that every time the patient comes into the clinic, this is what happens. The patient is then counseled and given directions and what further to do, especially given that their condition that they are presenting with. The patient is then wheeled into the next part of the clinic, whereby it's either they're coming to see a doctor or a nurse, but they can easily access the halls of the clinic. We can see that the disabled toilet or facilities are out of use or out of order, but our patient tries to access the ladies' room. This does not have enough space for the patient to maneuver around the ladies' room. The door can't even close. So we can see that this is a hindrance to the patients coming into the clinic. The patient is then wheeled into the nurse's room, whereby they're seen by a senior nurse or doctor, and they can adequately express themselves in terms of what condition brought them in. The patient is then wheeled out of the clinic, and we can see that there's also enough space within the halls, although it's a bit tight. We'd like to thank the Winklespruit clinical manager and supporting staff.